What's up, folks? How many of you are still stuck with stretching your triceps, your upper arm in this kind of manner? And you're having to do it all the time because it doesn't actually do anything. Nothing's really changing back there. Now, typically, you can't actually really stretch your tricep effectively. You clearly cannot flex your elbow enough to stretch it going this direction. So we try to get it going that way. And sometimes you can feel a bit of a stretching sensation, but what do we understand about static stretching? It doesn't actually change anything. It might feel good sometimes. You feel, hey, there's a stretching sensation. But what is that stretching sensation? You're trying to extend a muscle and it's trying to contract back, and it creates a sensation that we associate with stretching. But what we really want to do is that we want to calm down your central nervous system. We want to increase circulation. That goes along with increasing nervous conduction, so releasing pressure off of nerves, making sure that things can flow and conduct really well so that you can heal better, so you can have less pain, so you can perform better and be stronger. That's what we want to do. We don't want to stretch. We want to do what I just listed out. So triceps, we want to massage them out. We want to think about rolling them out. Using a massage ball, a pair of massage balls, use a foam roller. Foam rollers actually work really well. This would be more of, you can handle the pressure because this is going to be much more pinpoint, right? That's why we have like the idea of foam rollers versus massage balls. Overall, these are way, way better, vastly more important. Everyone should have a pair of massage therapy balls, but you should also have a pair of foam rollers, a big one and a small one. Why not? What we want to do here, guys, we're thinking back of the elbow. So you're thinking from the elbow point of the process right there, all the way down towards your armpit. And you can even get into the rotator cuff. This is very similar to, if you've seen my other video talking about massaging out your rotator cuff, basically doing the same thing, but extending this up. And ordinarily, I would probably just do this whole area. So side of the ribs all the way up to your elbow. So we're thinking roll up and down, roll side to side, shear. So remember, we have this difference of rolling the ball and shearing the ball. They're shearing the skin with the ball. So the ball's not rolling, it's dragging the skin around. So 2 minutes, set a timer there, click, timer goes, slowly, take some big deep breaths. Just play around with this. One of my favorite things to do as well, guys, is it's not just going up and down. And by the way, for shearing like this, you just simply hold the ball and you move your arm over it, just like so. So the skin is moving around and you're pulling all the layers about. Really, really useful, that one. That actually helps so much more with increasing circulation. But something else you can do is kind of pin the ball in place, or rather the ball in place, you pin your arm there, and then nice and slowly and gently move your hand up and down. So the ball's in place, and this is going to stretch and contract my triceps over the ball. Just a different kind of thing. Again, always be really, really gentle. It actually feels really nice, especially when I go kind of towards the outside of it. Word of warning when you're doing this, you want to be careful about going too far to the inside. So you have your bicep there and your tricep, right? And this kind of dividing area, and that's where we often massage out for like lymphatic massage. If you get up underneath your bicep, you can very, very quickly and easily find your brachial nerve and your brachial artery. They're just underneath. It doesn't take much to ping them, and it's very uncomfortable. And sometimes you can feel just these long, relatively rigid structures relative to a relaxed bicep there. And if you press them too hard, you can feel a zap down your arm or feel like your blood pressure just suddenly changed down or up your arm. Be wary of that. Don't get into that bit. It's kind of okay to go more towards the outside, but you want to spend, again, just 2 minutes rolling up, down, side to side. That's your mobility work for today. Of course, do this on both sides and see if that does not help you if you're going to be going into pull-ups, going to a bench press or overhead press, any kind of shoulder movement, press-ups, or going into, maybe if you're a boxer or a kickboxer and you use your shoulders a lot, or if you're grappling and you have a lot of shoulder techniques coming up, anything like that, any kind of exercise, any kind of movement, cross-country, Nordic skiing, whatever, it doesn't matter. But get up in there. Don't just rely on, doing your tennis racket stretch or stretching it across your chest. Get a ball or a foam roller in there. If you suffer with chronic pain, chronic injuries, athletic injuries, I have got you covered. My name is Ethan Hammond, and I am a strength and rehab specialist. I work with people who want to return to sport and fitness, but feel that they can't because of pain and injuries. I've helped people with conditions such as lower back pain, ACL tears, shin splints, neck pain and chronic headaches, and so many more things. Now, a lot of you will be going through things like this, like what I just listed above, and you're saying that you cannot train anymore. Bullshit. You have got to train, and you've got to train right. Train or complain, that is the way this works. Now, I work in person in Southampton, England, but I have online services as well if you're a bit further out. And I also offer free consultations to get you started with a free game plan and strategy for getting out of pain. All you have to do is to send me a text or a WhatsApp message to 07 305 231 339, and I will personally get back to you in the next 24 hours to get you started on the road to proper recovery. If you are serious about leveling up and making real change, this is how you start.